Hello guys, and welcome to this video. We'll be looking at implementation. This time around we'll be looking at how to understand the charts. Okay, understanding the charts. And then the second aspect of this video will cover codes. In your implementation chart you have the codes, so this will cover, these are the two aspects of the videos that we are going to be covering. So let's get started into it now. Thank you. So we'll be looking at the implementation chart. Okay, so the scenario will be written down on it, and this is where you're meant to write your name. You can do this at any point of the exam. So let me just write my name, Nurse Emmanuel. Okay. All right. So this other aspects, the most important thing is this part of the chart where they say assume it is today and it is 1600. This is the most important part of this first page. Okay. So it means any medication that does not fall under this 1600 hours, I'm not giving it. So go to my next page. Now, this next page, you can see that another thing that is very important is this line here: hospital medication prescription and admission record. Now we could have community medication prescription and admission record. So but this one is for hospital setting. Okay, now you read out all this information during your, when you are doing your 5 hours. So your patient name, Green David, date of birth 07010, then 10 1968. So you read everything out this way. Okay, this is the doctor that prescribed this. You read it out again aloud. This is Dr. A. Bullard. The GMC number is here, the signature and the blip number are all there. Now this is where you write your name as the person administering the medication. So now I'm going to write my name here, Nurse Emmanuel, initial NE, then I'll sign. Then the base is the word, and then you see they wrote MAU here, so I can just write MAU. Now this patient is allergic to penicillin here and peanuts. Okay, and then the reactions or the effect is anaphylaxis, and then yes, anaphylaxis basically for the two of them. That is the second page. Okay, now the third page is now where we'll talk about, remember I said we're going to talk about the codes. So you have code 1 to code 10. Now code 1, code 2, code 3 and code 4 are not applicable most times in your exam scenario. They are not applicable. But for code 5 is applicable, code 6 is applicable. What is code 5? Start dose giving. So let's assume that a medication was given, okay, under this once only medication. Okay, let's use paracetamol for example. Let's say paracetamol was given, okay, and you know paracetamol should be given, the interval should be 4 hours, okay, 4 hours apart. Now if this paracetamol was given less than 4 hours, and now under regular they are now asking you to still give paracetamol, because it's not up to 4 hours, you write 5. I'm coming to explain this. So but code 5 means start dose giving. Code 6 is prescription incorrect or unclear. So if any aspect of the prescription is not complete or is not clear, you write code 6. Now code 7 and 8 is not also applicable in an exam situation. Now code 9 is applicable anytime you are giving antihypertensive medication or you are giving digitalis medication like digoxin. Then know for sure that this code 9 will be needful. So you should always check the patient blood pressure or ask the examiner of the blood pressure and the pulse rate before administering. And if it is low, do not give the medication, write code 9 there. Okay, then this one is other reasons. Okay, usually the most common reasons here is allergy. Okay, so basically that is how the codes work. Code 5, 6, 9, and 10 are the ones you should really look out for in your exam. Now let's go to the next chart. In the next chart now, I now have where I've already read all this to the hearing of my assessor and my patient. All I need to say is that this tallies with what I read earlier on. Now, so this prescribed oxygen, you can see that no any oxygen is prescribed, right? Nothing is prescribed here. So I will just quickly move. It's actually prescribed, but it's not due at our time. Okay, remember it's 1600 hours that we are looking at for. So you just quickly just pass this and then go to the next chart. All right, now let's go to the next chart. The next chart now, this is where you now have your medication. So you read this out: antimicrobials, and then the first group of drug here is amoxicillin. Okay, now as tempting as this could be, you are not giving this medication. You know why? Because our patient is allergic to penicillin. So what should we do? Even though there's 1600 hours here, I'm not going to give this medication. So what I'm going to do, I'll write code 10 here. All right, I'll just put 10. But this is not at this point. You do it after you've administered the medication. I'm just teaching you how to fill this chart. Do not fill anything here while you are still doing your medication implementation. You fill this part of the chart after you've administered the medication. So I'm going to write code 10 here because why? The patient is allergic to amoxicillin. So I'm going to talk about 10 later on. Now, there is no any medication here. I go to the next page. Now, please do not forget to also tell your patient that he's meant to have amoxicillin right now, but you're not going to give him because he's allergic to amoxicillin. Now, the next medication here under regular medicines, I have ramipril. Now, you remember ramipril is an antihypertensive medication. So I'm going to ask my assessor I'm going to ask for the patient blood pressure. So now everything is correct. The patient, the date is today, the dose is 5 milligram, frequency is daily, route is per oral, duration is continuous, start date is today, instruction, everything looks fine. Okay, the doctor's name is written, A. Bullard, the doctor's signature and blip number. So everything looks perfect here. Okay, except that there is no, except that I need to ask for what the patient blood pressure. So if my assessor said, for example, the patient blood pressure is 120/80, that is fine. Then I'm going to go ahead and administer this medication. After administration, I will sign. Okay, I will sign and put my date. So today's date is 2nd 7/25. Please remember, this is after you've administered the medication, not at this stage. Okay, after you've administered. And then note that in the newer charts, this indication used to come with indication here, the newer chart. So this is not like a very new chart, so just take note of that. The new chart will come with the indication. Now let's look at the next medication, levothyroxine. The date is today, the dose is 100 microgram, the frequency is daily, route is per oral. So I can also see that this medication, everything looks perfect and correct, and it's still 1600 hours. So after I've administered the medication, I will also sign and then put my dates. Okay, this way. Now, this is after I've administered the medication. Now, simvastatin, date is today, dose is 10 milligram, frequency is daily, route is per oral. So everything also looks perfect, but it is not my time. Remember, my time is 1600 hours. So this is not my time. I'm going to pass it. Okay. Now I'll go to the next page. The next page now is still regular medicine, and then I have paracetamol. And now for paracetamol, please always check the patient weight. My patient weight is 85 kilogram. Now, if my patient weight is less than 50 kilogram and the doctor wrote 1 gram, do not give. It is incorrect. So your doctor will need to write this. So please, sorry, this is as required, not regular. This is as required medicine, or you can also call them PRN medication. Now, so the date is today, dose is 1 gram, frequency is 4 to 8 hourly, and duration, okay, duration is not written, start date is not written because it is as required. Okay, it's as required, meaning at any time the patient needs it is when you will give this medication. So what you will do here is to first ask your patient if he's in pain. If your patient says he's in pain, then you will ask him when was the last time he had the medication, because if he had this medication less than 4 hours, you will not give. But if it is more than 4 hours, you go ahead and give the medication. This place, you write the time, which is 1600. If you are giving 1600, then you put your signature and date in this point. Now, this is if you are giving, but if you are not giving, you just leave. All right, this is the last part. This is the last page of your chart. This is the last page of your chart, and what you are going to see is infusion, which obviously you are not going to be giving infusion here. So please keep this part. This omitted doses of medicine coded 10. Remember, you coded amoxicillin 10, meaning you need to come and write the reason why you did not give it here. So I'll come down here and then write today's date, 2nd of 7/25. The drug name is amoxicillin. Then the dose is, let's say, 500 milligram. The route is per oral. The instruction is usually for, it wasn't given in the chart, but it should be for infection. Now, time given, it was not given. So you just write not given. Now, what is the reason? Why didn't you give it? Just write allergic to penicillin. You put your signature here. This is pharmacy check. You don't need to do anything here. So this is how to basically complete your implementation charts. I hope this video is helpful. If you like it, please do well to subscribe, comment, and like this video. Thank you so much.